The MitraClip operation is a state-of-the-art keyhole surgery designed to fix regurgitant or leaking mitral valves. It's a really neat and innovative procedure, and it's all done through a small tube placed in the leg, which means patients don't have to have open heart surgery. For the first time, we're now able to offer this operation locally for Sunshine Coast patients, which means they no longer have to travel to Brisbane or interstate to receive world-class care. At Heart HQ, one of our visions is to be able to offer state-of-the-art treatment for patients locally on the Sunshine Coast. And to do that, our heart valve team underwent the necessary training and accreditation to be licensed to perform this state-of-the-art procedure here at Sunshine Coast University Private Hospital. We're the only centre outside of Brisbane who's licensed in Queensland to do this.
I voluntarily went for a stress test, and part of the stress test is a CT scan. From the CT scan, as a consequence, my GP rang me and said, "We need to see you, you've got a heart problem." Dr. Peter Larson gave me the great news. We think we can circumvent the bypass and we can now fix you with a mitral valve clip, which should fix your leaking mitral valve problem. It was an absolute miracle, and to be able to not go through the open chest surgery was just, I was terrified of having that surgery. It was an absolute miracle and a blessing that I didn't have to go through it. Here I am 12 months later, and my energy levels are still way, way up.
So mitral valve disease is common. It's common as people get older. So in men and women over 60, about 20% will have some degree of mitral valve disease, and about 4 to 5% will have a severe degree of mitral valve disease. Commonly, people just put it down to getting older. They think they're getting a bit breathless, things are getting harder to do. They may get some mild swelling of their ankles. It's often put down to being older, maybe some blood pressure, some other condition. Our patients that we've done have been firstly relieved that they haven't had to travel to Brisbane. Their carers have been able to stay close by. Patients will stay in hospital one night generally, and then we'll go home the following day.
We've got the Sunshine Coast University Private Hospital, which is 35 minutes away from my home. It was fantastic, as opposed to having to travel to Brisbane. There's quite a few trips involved, you know, for analysing, for pre-surgery assessments. It's just so easy. 35 k's from home. It was fantastic.
It's variable depending on state and some other circumstances, but generally about $50,000 is probably the going rate for treatment. Now we have accreditation. Medicare reimbursement means that there's no out-of-pocket expenses for patients for these sorts of procedures.